In this chapter, we are going to be exploring toddler nutrition. So we're looking at ages about 1 to 3 years old with our toddlers. So please follow along the PowerPoint presentation as you are listening to this YouTube video. Let's begin with talking about how many toddlers are living in poverty. In 2009, it was recorded that 14.7 million toddlers were in poverty. 23.1 million have a parent without a full-time job. Therefore, there's no benefits. It's very important for a growing child's health to have adequate access to health care. That means that 7.5 million were recorded with no health insurance. 34 million come from a single parent household, and this creates a huge barrier and challenge to properly feeding this infant, or this toddler, So let's start at the beginning talking about what are some of the major differences between feeding an infant and feeding a toddler. We just finished exploring infants last week, and now we're going to be moving on to toddlers. Overall, toddlers are starting to explore the environment. So we see a slower growth rate, which then is going to be reflected in that toddler's appetite. So because toddlers are not growing as quickly as they were when they were infants, their appetite naturally decreases. This becomes extremely hard for parents because they think that they need to feed their child, but their child is a really good regulator of that appetite. So we want to make sure that we can follow those cues of the toddler and let him or her understand its appetite. So as we were saying, they begin to explore the environment by crawling, walking, scooting, and this is going to demonstrate that they get to be separate from you or roam away. A lot of toddlers are starting to learn to say no. So this can be frustrating during feeding time. There's a wide variety of growth, activity, and nutrient requirements, and food intakes can drastically differ between toddler and toddler. So if we discuss toddler feeding behaviors a little bit more in depth, what we can see is an independence comes to life. Strong food preferences and dislikes start to appear, and they can even happen overnight. Toddlers can quickly lose interest after one bite of food. New foods are better accepted if they are served when the child is hungry. Sorry guys, I live downtown and a fire truck just went by, so if you could hear that, I apologize. So let me just repeat a little bit of that. Toddlers demonstrate strong food preferences and dislikes, and this can happen overnight. At about 12 months old, they have a noticeably increased likes for food and dislikes for food. They reject new foods frequently, so it's best to offer new foods when the child is hungry. Also, they like to do this monkey see, monkey do. So if mom and dad are actively eating this new food, then toddler is more likely to accept this new food as well. So the definition of these life cycles, the toddlers are that age 1 to 3. Preschoolers are considered 3 to 5 years old. School age is 5 to 10, and pre-adolescence is 9 to 11 for girls and 10 to 12 for boys. When we look at the Healthy People 2020, the target is basically to increase the amount of fruits and vegetables and whole grains that the toddler is consuming, and also increase the amount of proper proteins that the child is consuming. So we don't want them driving through McDonald's unless it's an absolute last resort. Toddlers rapidly increase in gross and fine motor skills, which increases that independence and language skills. Preschoolers have a greater social skill and increasing language, and they have the better ability to control their behavior. So how does this affect their meal times is really important to understand. Toddlers are skeptical. They don't automatically like new food. They have to experiment. There's a great sensory integration therapy where a toddler can touch and play with the food and feel it in its mouth. This gets them to experience all of the aspects of the food, so then they're not so skeptical. Again, if they taste it and take it out several times, that's okay, because then they're just exploring their environment. Meal times are extremely important for toddlers because it provides them time to practice language skills. They can practice social skills. It helps develop a positive self-image, and it is not a time for force feeding. This is the most important bullet point I can possibly say. Mealtime is not a time for force feeding. I know that all of us probably grew up in an environment where mom and dad said you can't leave the table until you completely clear off the plate. This is wrong. We need to teach our children to be in tune with their full signals. So we want them to stop before they're completely stuffed to the brim. So toddlers are erratic. What they like one day, they're not going to like another day. And they eat a lot one day and a little the next day. But that's okay because it balances out for them. They're great intuitive eaters. And they may only eat one or two foods served. And that's all right. They're starting to explore their environment. Again, it's really important to develop and practice these skills and have that good role model as a parent, because toddlers rapidly decrease their interest in food and can get easily distracted during meal times. Another thing is toddlers are messy. So you gotta love all that spaghetti on that kiddo's face. They really enjoy mealtime, and it is time for them to play with their food and explore. So don't yell at them for playing in their food. It's just part of their growth and development. Now let's talk a little bit about their growth rate. They're going to have approximately 4 to 6 pounds per year increased. So toddlers around 8 ounces per month, and preschoolers it's going to be around 4.4 pounds per year. This is an average growth rate in weight. For inches, it's approximately 0.4 inches per year, and it increases for that first 7 years of life, from 1 to 7. Around puberty is when they're going to start growing rapidly faster. So this is when their appetite is going to increase significantly because they're growing so much more. You can see the huge difference is now 2.75 inches per year. They become leaner, so their lean body mass, which is LBM, accounts for a greater percentage of the weight. Fat decreases, however, females do have more subcutaneous fat, and that's because females are getting prepared to carry a child. By age 2, the brain growth is 75% done. So you can see that those healthy omega-3s are essential for that brain development. And by 2 to 3 years, their fluid composition is the same as adults. So they're going to have to start drinking a lot more water, which so many children are drinking juices, which is not appropriate for them. So using growth charts, we're going to go to the next slide. You're going to use a length where the baby is laying down until 24 months. And if they do use a standing height, then the shoes need to be removed. This is going to detect excess or inadequacies with nutrition. You can tell if a child is maintaining a height or weight in relation to other children. So this is when those CDC growth charts are essential. Now remember, there are different growth charts for females and males. So BMI in 2 years or older, there's a guideline for BMI. And what this looks like is saying that an 85 to 95th percentile is at risk of being overweight. Greater than 95th percentile, that child is considered overweight. Under the 5th percentile, that child is considered underweight. This is going to fluctuate with age. It is highest in infancy and lowest during 4 to 6 years. So if you want to move to that next PowerPoint, you can see there's a sample growth chart here. So is your child overweight for his age? If we look at boy A, you can see that he is above the 97th percentile. This means that he is considered overweight because he's above that 95th percentile. Now child B falls between the 50th and 75th percentile. So this means that child boy B is okay. He is considered a normal weight. So we really want to make sure that we are following these charts. So if you move to the following line, where you can see there's a couple of blue dots along the way, the top part is the length and the bottom part is the weight for this girl. So it's a girl who's charted for her age and length and weight. And you can see that the trends are the most important. So this child is doing good, kind of steady along the way, increasing. So we wouldn't be too concerned. This child is getting proper nutrition. So what is the definition of weaning? let's talk about what weaning means. Weaning is when an infant gradually gets weaned off of, let's say, breast milk onto the solid foods. And then around 12 months, they're going to be weaned off of that breast milk or infant milk to cow's milk. So any change in food flavor, texture, consistency, temperature, or other type of feeding is considered weaning. This is a difficult task for infants to learn. This is why we're going to really amp up that weaning around 9 to 10 months, and it's usually completed by 12 to 14 months. During this time, they can reject food quite a bit, but it is important to continue to watch this baby's cues for when they are ready. So how do you feed your toddler? You are in charge of the menu. Everyone gets offered the same foods. You don't want to make up special foods just for that toddler. You can make a few modifications to make the chewing/swallowing easier, so maybe adding a little bit of texture to it or chopping it up in order to make it a softer texture. We do want to offer a variety to increase the chances that the toddler will find something manageable, but we do not want to cater. So if you're making yourself chicken and broccoli and the child wants macaroni and cheese, that's not necessarily the best way to go about it. We really want them to continue to model after the parent eating foods that the parent is eating. So what are some feeding skills attached to what the development is? Under 12 months, we need finger foods because they're best defined by their pincher grasp. Around 12 months, they lack wrist control for spoon management and cup is difficulty. This is why you always see a sippy cup. Around 18 months, they can lift elbows, they can flex their wrist, they spill less, and now they can actually tilt their cup using their fingers. Now a toddler, this is when time for food increases, and we need about 1 to 2 tablespoons per age of serving. And they also require snacks. Snacks are required because they need the calories and they are eating such tiny portions. For example, a 2-year-old, a serving size is going to be 2 tablespoons. That's a very small amount of food. So feeding skills continued. Preschoolers want control. They like to use forks, spoons, and cups as well. They're not quite as messy and spills still can occur. They do need supervision, however, because of the choking hazards. Preschoolers do have some growth spurts, so they have an increased food intake, but again, they're going to be the regulator of this when growth is happening. This is a great time to teach the infant. It's best to give the child smaller portions and allow him to ask for more. And snacks, again, as I said, are vital due to those small portions. You should not allow them to graze on beverages and sweets as snacks. The toddler and preschooler will eat as much as they need, and that is really important, and I can't stress that enough. However, parents do need to set boundaries by the choices they're given. One of the really interesting things is you can give the child an option, and you can say, well, do you want carrots or do you want celery? And because the child feels like they're getting an option, they're going to be more likely to engage and consume that vegetable. So make sure that the adult is setting those boundaries, but giving choices as well. This concludes the first video, so please play the next video.